this week's edition of the Three Things You Need to Know in Healthcare in Tallahassee. This is Fraser Cobbe. I'm the executive director of a number of the medical associations across the state, and appreciate y'all joining us for this edition as we fill you in on what happened in week 2 in the Florida legislature. I do want to introduce my colleague here, Joe, and have him formally introduce himself as well.
Fraser, good to see you this week. I'm Joe Daraskevich. I work alongside Fraser for a number of societies across the state. So it's a great chance to kind of give everybody a little recap about what goes on in Tallahassee each week.
Yeah, we've got a lot to talk about this week too, Joe. It was a busy week up there. For the associations we work with too, we had a bunch of doctors from Miami-Dade County that were up, our largest delegation ever, which was fantastic to see so many physicians take time away from their practice to help us walk the halls and push some of these issues. So it was a great showing from the Dade County Medical Association, and we had a number of really positive meetings with the Dade delegation up there. So just wanted to give a shout out to our physicians down there in Miami for their efforts.
Yeah, that's great. That's great. How was the weather over there in Tallahassee this week? I know it's been a little chilly around the state.
It was freezing. It wasn't too bad for me being in Tampa. I'm a little bit more used to it, being up there than our Miami doctors, but I think it was shocking for some of them. But we struggled through. Once we made it in the building, we were nice and warm. But yeah, there were some frigid moments there getting to and from the Capitol.
I guess so. All right. Well, you want to just jump into the topics for this week?
Yep, let's do it.
All right, first one, Fraser. The Florida Senate passed the Live Healthy legislation. Now, we talked a little bit about that last week. What's the update this week?
Yeah, so the bill passed out of the full Senate yesterday, and actually a number of the doctors that were up there, we got a chance to witness the debate on the floor of the Senate. The bill was being carried by Senator Colleen Burton out of Lakeland. And of course, it was the Senate president's main priority this year, which is why it's made it all the way through and been passed by the Senate so quickly into session here. But it was great to be there for the debate. It was lively. It was recognized just how large the package is that they have passed. There's a ton of good things in the bill. For healthcare in the state, a lot of money that's going to be coming to expand graduate medical education, to expand student loan repayment programs for healthcare professionals. So there's a lot of good in there. It's the largest bill we've seen passed in a while. It was some 300 pages. Even a staff analysis was getting up to 100 pages. So there's a lot to work through in there, and we'll have to clean up some things over the years as we go through implementation of all the rules. I will say the FMA did a fantastic job cleaning up some of the language that we had concerns with around just making sure as we open the state up to doctors from other parts of the U.S. and foreign countries come into the state to practice, that we have some measure of the quality of their training and the services are going to render to Floridians. So I think we did a great job cleaning up the bill. Congratulations to the Senate for passing it. Now the House version is a little bit different. So in order to pass both chambers, the language has to be identical, right? So there will be a little bit of give and take between the House and Senate here over the next few weeks. So we'll see what the final product looks like. But it is great to see that bill pass, and such an investment the state's making in the future of healthcare delivery here in Florida.
Clearly a top priority, and like you said, they're going to have to kind of get that language synced up. So we'll keep an eye on everything as the weeks go on. Looking at our next topic, the health insurance ID card and dispute resolution bill is now moving forward in the House.
Yeah, so that bill passed its first committee in the House this past week, and it's a priority bill for the FMA, for a number of specialty societies and our county medical societies as well. The two main things it does, it's very consumer friendly. It would require all health insurance cards here in the state to have on the back of the card a QR code that will direct patients to the Department of Financial Services website. It exists to help patients navigate any complaints or difficulties they're having in utilizing their health insurance benefit. So there's a website that is in operation. It gets seldom used, and I think most of that is because nobody knows it's where it is and whether their plan is regulated at a state or federal level. So we think if we can provide consumers, a direct link to that website, that a lot more of them will be able to get some of their frustrations with using their health insurance benefit taken care of. According to the Department of Financial Services, they're getting resolution on complaints submitted through that portal within 48 hours. So it's a great tool for patients, and hopefully will make it a little bit more accessible if that bill actually gets passed. The other component is dispute resolution. So the state has a dispute resolution process set up for hospitals and physicians to dispute reimbursement concerns with insurance carriers. Several years ago, the insurance carriers decided that process is voluntary and have opted out of participating altogether. And it's gotten so bad that the state's contractor just ended their contract this last year with the state of Florida because they were getting no business out of it at all. So the language would make it clear that it's optional for either the insurance company or the healthcare provider to bring a complaint to the dispute resolution process. But once a valid complaint is there, then it is mandatory for both parties to participate in that mediation. So it would be huge to get that loophole fixed and provide a real avenue for recourse for hospitals, physicians, and insurance carriers to resolve those reimbursement disputes. So that bill still has a couple of committees to go in the House, has not moved over in the Senate yet. So it's still got a long way to go, but it was great to see some positive movement this week.
Yeah, yeah, and a lot of details to that one. So it's good to be breaking that down for everybody as we get closer to the finish line on that. Third topic this week, Fraser, the scope of practice expansion bills sort of stumbled out of the gate. I mean, was it a big stumble? What are we talking about here?
It was interesting, to say the least. So it was in the House Healthcare Regulation committee meeting this week, and there was two bills being heard. Both of them would provide autonomous practice for advanced practice nurses. So the first bill would have allowed psychiatric nurses to practice autonomously. It's an effort grounded in the ability or the desire to make mental health services more available to the state. Organized medicine has, or to patients in the state. Organized medicine, of course, has some concerns. Just with the nurses working outside of a team-based, physician-led team, when they're providing mental health services. So that bill, as it was explained, the bill sponsor had a few issues trying to explain the bill and what the impact would be. So ultimately, they decided to temporarily postpone the bill. That's commonly referred to as TP'd. So it's very rare to see a bill TP'd in the process, just because typically they know before the bill even gets on a committee hearing whether they have the votes to pass it out or not. So it's very rare for a bill to get TP'd, but that bill did. And then right after that, the next bill up was another scope of practice expansion, the autonomous practice for CRNAs, nurse anesthetists. And that bill was due to be heard next, and we had some doctors up there to testify. But the chairman of the committee announced right after the psychiatric nurses bill was TP'd that bill was TP'd as well. So most likely there was some additional work that needed to be done on that legislation. And so while it's rare to see one bill TP'd, it's really rare to see two back-to-back TP'd. But we were glad to see it. We definitely have concerns with continued expansions of autonomous practice for nurses. The state of Florida has allowed primary care autonomous practice for the last several years. We are concerned as now the nurses are looking to expand into specialty care as well. So we'll continue to stay on top of that and continue to raise concerns around patient safety, and that a physician-led team is the most safe and efficient way to deliver care in the state of Florida. We're not sure if either bill is going to get put back on the agenda for healthcare regulation next week. It may or may not, and we'll certainly let our members know once we hear for sure if it's up on the agenda.
Well, and the rarity there of those two TPs. I mean, are we talking once a year? How often is something like this going on?
It is very rare, and that's I was talking with Chris Clark a little bit from the FMA. He's the CEO of the Florida Medical Association. It's become extremely rare just because, again, the leadership wants to make sure that the bill sponsors are pushing their bill or lining up the votes to get it passed before they even put it on the agenda. So it's been a while since I've seen a TP at any time. So to see two in one committee hearing, it was kind of unique and fun for our day doctors to be there to see it all unfold that way.
Well, that's pretty exciting. Kind of getting up there at the right time to see a lot of action. Those are
Yeah.
three pretty big topics, and Some of them seem like they're kind of cruising along, no big roadblocks. Some of them seems like they're kind of having to go back to the drawing board. But pretty good recap for this week, Fraser. Anything else on your mind that we need to get out there?
Well, yeah, now it's Friday afternoon. I'm about ready to look forward to the weekend and then next week. And next week's not going to be a quiet either. We've got a bunch of doctors from Orlando going up next week from the Physician Society of Central Florida. There's a few bills being heard. The wrongful death expansion is up on the agenda for Monday afternoon. We've got our workers' comp fee schedule legislation that is due to be heard in Senate Health Policy on Tuesday. And we're not sure yet, again, if those scope bills are going to come up Wednesday. So it's going to be another busy week in Tallahassee, and we look forward to sharing all of the happenings at the end of next week with our membership.
I feel like last week we were just kind of dipping our toe in the shallow end, and now we're full-fledged swimming in the deep end now. So we'll keep everybody updated each week here, and you know where to check in. So we'll look forward to kind of seeing what happens next week, and good luck on the weather up there next week. Hopefully it's a little calmer than it was this week.
Yeah, definitely. It can't be any worse, I don't think, but we'll
Don't
see.
say that. Don't say
I know,
that.
right? Just jinxed us.
All right,
All
Fraser.
right.
I guess I'll see you next week.
Yep, Joe. Have a great weekend.